Hey guys, Adam Gill here with MedicareForYou.net, and today I'm going to give you a little bit of information on Medicare Advantage. I talk to clients and customers all the time, and they may think they have a supplement and they have a Medicare Advantage plan, or they're not sure of exactly what kind of plan they have. So today I'm just going to give you some information on a Medicare Advantage plan. Okay. You have Medicare supplements out there too, which that will be a separate video. But today, if you choose a Medicare Advantage plan, I just want to give you some information to consider when you're looking at a Medicare Advantage plan so you know what you're getting into. Unfortunately, not every agent in the world explains everything in detail to you. So I just want to make sure you understand what you're getting into when you're out there shopping for insurance and shopping for your Medicare. All right. So first things first, what is Medicare? Well, Medicare Advantage is actually a plan that's offered by private insurance companies. Um, so what happens? You go to the doctor, you give them your insurance card from that company instead of your red, white, and blue card for original Medicare. So it's offered by private insurance companies that are approved by Medicare. All right. Now, if you join a Medicare Advantage plan, you still have Medicare. You're not getting rid of Medicare. You just have a Medicare Advantage plan that's now going to take place of your original Medicare, the red, white, and blue card. And so whatever company you're with, that'll be the company that's paying the claims. And that's where everything, all your questions will go to that insurance company instead of Medicare actually paying those. Okay. Now, Medicare Advantage plans cover all Medicare services that original Medicare cover. They're required to do that, so you're not going to lose anything in sense as far as what's going to be allowed, what is covered. And I'm going to get into in a few minutes how Medicare Advantage plans work. Now, Medicare Advantage plans may also offer things like vision, hearing, dental, health and wellness programs. So a few things that they can offer that you may not get with a Medicare supplement or original Medicare. So just some things that they have on there a little bit different. Also, most Medicare plans, Medicare Advantage plans include your prescription drug coverage. So if you have a Medicare supplement or if you have original Medicare, you would get a standalone drug plan by itself. But most Medicare Advantage plans actually include your drug cost, your drug coverage all in one plan. So something we'll get a little more detail in a few minutes here. Now, some rules for Medicare Advantage. Now, the way Medicare Advantage works, so Medicare actually pays a fixed amount of money for care each month to the insurance companies that are offering the Medicare Advantage plan. So for every member that insurance company has, Medicare is giving that insurance company money for every member they have. So that's one reason why it's good for these insurance companies to make their plans competitive and try to make their plans that are really good and the benefits because the more plans get more beneficiaries they have, the more money they're getting from Medicare. Okay, so that's how the insurance companies are making their money. Now these companies must follow rules set by Medicare. However, and this is a big however, each Medicare Advantage plan can charge different out-of-pocket costs. Now I'm going to get into this more detail in a few minutes, but that's a big deal because if you're with one plan that's going to cost you $6,700, one plan that might cost you $3,400. One plan might cost this much to go to the hospital. This one costs you this much. So we'll get into that in a few minutes here, but that's a big deal as far as out-of-pocket costs go. All right. Now, in order to have a Medicare Advantage plan, you have to have Medicare Part A and Part B. If you don't have Part B yet, you can't get a Medicare Advantage plan. You have to have Part A and Part B. All right. You must also live within a Medicare Advantage service area where that actual insurance company offers plans. Medicare Advantage plans are very county specific. So what do I mean by that? If your friend over the next county has a plan that you really like, that plan may not be offered in your county. So every county is different. So it's good to be able to look, and you actually go to Medicare.gov, put in your zip code, and you can see all the plans you want in your area to give you a good idea. That's also the benefit of talking to an independent agent. If you have an independent agent, they should have several companies to offer you. If you're talking to a captive agent, they're only going to offer you one company, and guess what company they're going to show you is the one company they have. So it may not be the best for your situation, but that's the benefit of talking to an independent agent that has several companies. They can give you a comparison of all those policies, different plans that are offered in your area, and make sure it's the one that fits you best. Okay. Now, you do have an annual enrollment period. Let's say you're in a Medicare Advantage plan and you don't like your plan and you want to get out of it. Well, you can't do it in the middle of the year, but there is an open enrollment period every year, October 15th through December 7th. You can actually switch your plan. Okay. So that's something to really to be aware of. You'll be aware of it because you'll get stuff in the mail like crazy from all these different insurance companies. You'll get see commercials and you might even get phone calls. But you'll know it's open enrollment by October 15th through December 7th. If you're not happy with your plan, that's the time you need to look at other options that are out there, look at different benefits, and find something that fits your situation the best. Okay. Um, Now, if you do happen to get into a plan or open enrollment, there is a disenrollment period from January 1st through February 14th. But if you go to a Medicare Advantage plan, you can't go from one Medicare Advantage plan to another. All right. You can go back to original Medicare and do a supplement if you wanted to, but you can't go from one Medicare Advantage plan to another. So it's very important when you're looking at your Medicare Advantage plan just to understand those benefits, so you know what you're getting into. But if your agent's doing a good job, you should have no concern about what your plan covers. All right. So Medicare Advantage, this is really the nuts and bolts what this video is about. Okay, I want to give you a good understanding of what these plans are going to do for you and what to look for. So your biggest two plans you look at are HMOs and PPOs. These are very similar to what you would have had when you worked for a corporation or had a job. Okay. There's also things like special needs plans if someone's on low income or has Medicaid or has a certain disability or a certain health condition. There's different plans that are offered for that as well. So if you do have Medicaid, you can let me know and I can always help you out with those plans also. There's some good Medicare Advantage plans that go hand in hand with Medicaid that can really give you some good benefits too. But this one's really about the HMO versus PPO because that's what most people are going to be looking at. All right. Start off with HMO plans. If you haven't heard of an HMO plan, what this is, it's a plan that you have to use in-network providers. Okay. So what I mean by that, if you have company A and you have a clinic in town that you want to go to, and they take company A, then you can go to that doctor, to that whole clinic, whatnot. If they do not take that company, if company A, you want to go to that same clinic and they don't take it, you cannot go to there. You have to go to a different doctor that takes that plan. Okay. Now it's a lot different than what a Medicare supplement is, but again, that's a different video we'll go over. But on a Medicare Advantage plan, make sure you understand that when you pick that plan, you have to go to a doctor that takes that plan. All right. Especially on HMO, you cannot go out of network. All right. Now, if you ever have an emergency or something, you can go to the emergency room. That's not going to be an issue there. But for any kind of doctor office visits or anything surgeries, you have to go for in-network. Okay. Now, you usually need to get all your basic health care through your primary care physician. So you have to go to your primary care physician for everything that you need. Now, if you need to go see a specialist, most time also you'll need to get a referral from your primary care physician to see a specialist. So if you have some health conditions and you see a lot of different doctors, it's very important to make sure all of your doctors are in network and to make sure you're okay with getting a referral. I mean, that's one of the biggest things that I hear all the time. I'm tired of getting a referral to see a specialist, or Adam, this doctor's not in the network, things like that. So there's different things to consider on an HMO. Just make sure you pick a plan or make sure your agent's looking for the plan that has all your doctors. And just be aware of the referral that's going to be needed for an HMO plan. It's something that you need to understand. A lot of agents won't explain that very well, but you will need a referral and just make sure your doctors are in network. Biggest things. Also, most of these plans are going to cover Part D drug coverage, okay? This is a big deal. Make sure your agent looks through the formulary on that plan and make sure all of your medicines are covered. If they're not, make sure they're finding a way to get them covered, all right? Your medicines can be a big deal on these Medicare Advantage plans. All right, they can cost you a lot of money if you're not on the right plan. You may pay $10 copay at one company and a $40 copay at another company. Make sure your agent is going over all of your medicines. That's one of the biggest things to look for. Your medicines can cost you a lot of money when it comes to Medicare. Make sure you're on the right plan. Make sure your agent looks at all your medications. Okay. PPO plans. Now, one of the main differences here with the PPO is flexibility. What that means, you can have a bigger network of doctors to go to. You don't have to get a referral to see a specialist, which is right here. You don't have to get a referral. You can call the doctor up. Hey, do you guys take such and such plan? Yes, I do. Great. I need to make an appointment to come see you. It's that simple. You don't have to go to your primary care physician to get a referral. Okay? So it's a really big deal if you're seeing a lot of different doctors. If you're traveling at all, also with PPOs, if you travel at all, An HMO is not going to give you out-of-network coverage. Okay, if something happens when you're traveling, you can go to emergency, but that's it. You're not going to go see a doctor. PPO is going to give you out-of-network options. Okay, now do you pay more for that? Yes, you do, but at least you have the option to go out of network if you want to. All right. Now the downside of going out of network, like I said, is you're going to pay more. That just is what it is. But if you have a major health condition, you want to see a certain doctor, it is, well, at least you have the option to go to that doctor. Okay, so that's the biggest thing to consider. Now, PPO versus HMO, PPO has higher co-payments, higher out-of-pocket costs typically, but like everything, if you get more benefits, more flexibility, more access to a bigger network of doctors, it's going to cost a couple dollars more, but it just gives you a lot more flexibility and gives you more control over your plan. You still have to stay in. You still have to go to particular doctors if you want to get the best pricing. Like if you want to go to a particular clinic in town, to where you live at, you want to make sure that clinic or that doctor takes that plan. You still have to stay in network as far as going to those doctors, as far as your primary care physician and specialist. But you have out-of-network options, but you save a lot more money by staying in network. So just make sure your doctor that you do go to is still in that network for that PPO plan. All right. Again, this also includes your drug coverage most of the time. Again, make sure the agent looks at those medicines. I can't stress that enough. If they don't look at those medicines, they're not doing the right thing for you. They need to look at every one of your medicines and tell you how much everyone's going to cost you before they leave your home or before they leave that appointment. You need to know how much your medicine is going to cost. You have to. Okay, very important. Some things to consider. Now, a lot of these plans have no monthly payment in addition to your Medicare premium, which is a good thing. But remember, it's not free. You're still going to pay for your co-payments to go to the doctor, the hospital, your lab work, x-rays. You have co-payments, and those are things that we can get into on an appointment, or you can talk to your agent about on the benefits. Make sure you know the summary of benefits. HMO plans require referral. Don't forget, HMO plans, you have to have a referral to see a specialist. Make sure you're okay with that. No matter if you're on a PPO or an HMO, you must go to doctors that accept the plan, and you must stay in network. Now again, the PPO has out-of-network options, which cost you a lot more money. But on your primary care physician where you live at, the doctors you go to most of the time, make sure they're in network. Doesn't matter which plan you go with. Make sure the company that you're looking at, that doctor accepts them as in network. Okay. Not all plans offer out-of-pocket network out-of-network coverage that we talked about earlier, which the PPO plan typically do. You can choose an HMO or a PPO. Biggest thing, make sure your medications are covered on the plan. I've talked about that. I just can't stress enough. Make sure your medicines are covered. If not, you could be paying $300-400 for a medicine that could cost you $25 with a company. Okay, make sure your medicines are covered. Another really big thing to make sure you're aware of, companies can change their benefits every single year. All right, your benefits can change every year. So that open enrollment period, October 15th through December 7th, you're going to get a new package in the mail from your company. They're going to give you new benefits. They're going to tell you the changes in those plans. Make sure you review those, or make sure your agent is calling you and telling you about those changes. If those changes affect you, you may want to look at other options or an open enrollment. Okay, because those benefits can change every single year. So it's very important to remember that your benefits can change every year. All right. Last thing here, just again, make sure to assess your needs and your budget. Do you prefer a plan that has low out-of-pocket cost for an HMO plan, or do you prefer to have flexibility and freedom with a PPO plan? Big thing to consider. Compared to plans in your area, benefits and premiums are different with every company. Just because you've had one company forever doesn't mean it's the best company out there. That's why it's important to talk to an independent agent. An independent agent can give you resources for different companies, and you can find the plan that's best for you. It's good to know what your options are. Just check again whether your healthcare providers you use are in the plan service area. Again, very important, like we talked earlier, make sure your doctors are in the network. No matter if it's PPO or HMO, it's going to save you the most money. Understand how the plan works before you enroll. If your agent doesn't go over the summary of benefits top to bottom, first of all, they're required to go over those top to bottom. So if they're not, they're already violating the rules already. But make sure they understand, just to do the right thing for you. You make sure you understand the plan you're getting into. If you don't know one thing, ask your agent about it, or find someone that will help you with it. But understand your benefits you're getting into, okay? And review your coverage every year, and decide whether you want to change plans. Again, open enrollment is October 15th through December 7th. You want to make sure you're happy with your plan. If not, look at what else is out there. Maybe something that's better for you, or find an agent you can trust that can keep you aware of what's going on. That's an agent's job, is to stay aware of what's going on in the industry and keep you aware of it. Okay, so if your agent isn't doing that, you need to find one that is. It's going to keep you aware of what's happening. Okay. Again, anytime during the year, providers can leave the plan. That's also really big. I've had it before where someone was going to a particular doctor in the middle of the year. The doctor office got bought out by someone else, and all of a sudden they're taking different insurance companies. So that's another big thing to consider on a Medicare Advantage plan. Providers can leave the network. So it could be on a yearly basis or whatnot. Just make sure they continue to keep you to use your plan. All right. Also, Medicare Advantage plans are not allowed to charge more than original Medicare, so you're not going to get charged any more than original Medicare. It's just make sure you understand the benefits on the plan, understand your co-payments and how much it's going to cost you. Okay. And the last thing here is you can't have a Medicare Advantage plan and a Medicare Supplement plan. The Medicare Supplements are great plans, something separate than a Medicare Advantage plan. We'll talk about that in a separate video. If you have questions, let me know. But this is really all about Medicare Advantage here. Okay. But it's really one or the other. If you have any questions at all, you can visit my website at medicareforyou.net or adamgiltinsurance.com. They both take you to the same place. But feel free to call me if you have any questions. I'd be more than happy to look at your plan. The biggest thing, too, is you may not need to switch plans. And if you have an agent that's trying to switch your plan every year, that may not be the right thing either. Just make sure you're on a plan that you understand, that you're happy with, and that fits your situation best. Just make sure your doctors are covered. Make sure your medicines aren't costing you too much money. And typically you're pretty good on a Medicare Advantage plan in those situations. If you think that's the best plan for you, great. The Medicare Supplement's great too. But if you have any questions, I'd be more than happy to go over your options and just at least let you know what's available to you, and what other options may be out there that could benefit you better. So hopefully you found this video helpful and give you a better understanding of Medicare Advantage. Just some basic stuff here, nothing crazy, but just some basic stuff to consider when looking at Medicare Advantage. Again, I hope you enjoyed the video. If you have any questions, feel free to contact me at any time. Thanks. Have a great day.